the JAMA Network.
One of the first questions patients ask after undergoing surgery is when can they go home? They rarely think about the possibility that a complication could bring them back to the hospital.
Patients simply don't want to be readmitted to the hospital, and they'd certainly rather sleep in their own bed rather than a hospital bed.
And hospitals can face financial penalties if readmission rates are too high. Dr. Karl Bilimoria from the Feinberg School of Medicine at Northwestern University and co-authors examined the reasons why patients return to the hospital after undergoing surgery. Researchers looked at 1 year's worth of data from the American College of Surgeons National Surgical Quality Improvement Program. They focused on 6 representative operations, including bariatric procedures, total hip or knee replacements, and hysterectomy.
In the time frame that we studied, roughly 30 days after the surgery, we found that about 5.7% of patients were readmitted to the hospital.
Readmission rates ranged from about 4% for a hysterectomy to about 15% for vascular bypass surgery of the legs.
The number one reason overall was wound infections.
The study appears in JAMA, Journal of the American Medical Association.
The second most common reason was also fairly similar across all of the operations, and that really was prolonged return of bowel function or their inability to eat right after the surgery.
Dr. Bilimoria says these are all expected complications of surgery, but develop after, not before patients leave the hospital.
And that will really help hospitals understand where to focus their efforts if they are to reduce readmissions. It also gives policymakers some information about how to craft readmission reduction programs going forward, particularly for surgery, because the reasons for why patients are coming back to the hospital really relates to expected complications.
Catherine Dolph, the JAMA Report.